My role, well, at least I hope what my role is to always be a resource to anybody of color who's walking through Fenway's doors. True story, many years ago here at Fenway, I just so happened to be covering a floor, checking patients, and it was the end of the night. A mom comes in off the elevator, African-American woman, and she's in tears. And I'm like, are you okay? What can I do? And she said to me, my son is an honor roll student. He got into one of the top schools in the country. And it was around the holiday time, so maybe like January, early January. And she said, I feel such shame because he came out to me. And I'm standing before you because in tears, as if my child, who's an honor roll student, going to an Ivy League school, is dying. And I got her resources so that she could connect with the right people. But what I walked away from that situation thinking is, wow, this mom has, when I think about, I grew up in the inner city in Boston, so I know a lot of moms who buried their children. And so to think that coming out for her son was such emotionally so much for her, and not in a bad way, because I actually respect the fact that she walked through our doors and said, can you help me? I need help trying to navigate what my child just told me, because I know that I need to love him unconditionally. And so we got her the resources, and I thought in that moment, I'm thinking to myself, there's so many Black families, Latino families who are experiencing this very thing and don't even understand and know that Fenway's doors open up. You don't have to pull them, you don't have to push them, they just open. And so I think my role is to be there when the doors open up, to remind you and assure you that we are here for you. And you can stop anybody in this building that's wearing a badge that look like me, and they're gonna help you. So I feel like we need to be inviting our community into this space, because the other thing that Fenway has always done very well is our patient HIV viral loads usually are, many years ago, because I don't know the numbers right now, I can't speak the numbers right now, but I could tell you that there was a time when more than 75% of our HIV patients were their viral loads were undetected. And I feel like Black people don't even know Fenway exists. They don't even know. And some of us are dying way earlier from HIV than we need to be dying, because we ain't accessing the right resources. Yes. And so, you know, I think my role is to say, please come, that we are here for you. And yes, we got work to do, and we gonna get better. And the reason we're gonna get better is because of all these people that's sitting at this panel right now. So that's what I have to share.